Assalamu alaikum, I'm Amira Nasrallah and I will talk about aortic aneurysm and dissection. First, I will explain the anatomy and histology of the aorta, then I will talk about the aortic aneurysm and dissection. So as you know, the deoxygenated blood will come through the superior and inferior vena cava to the right atrium, then to the right ventricle, then to the pulmonary arteries to be oxygenated there in the lung, and it will come back through the pulmonary veins to the left atrium, then to the left ventricle, and it will be pumped out the heart through the aortic valve to the aorta. The aorta have multiple segments. The first one is the aortic root, then the ascending aorta, then the aortic arch, then the descending aorta, and below the diaphragm it will become the abdominal aorta, and the abdominal aorta is further divided according to its relation to the renal vessels into a suprarenal abdominal aorta and an infrarenal abdominal aorta. So this is the aortic valve, which have three cusps, and these cusps will make the three sinuses, which are called the sinus of Valsalva. And here we have the origination of the right and the left coronary vessels. So the aorta has three main layers. First, the tunica intima, which contain the endothelium and the internal elastic lamina. Then we have the tunica media that contains smooth muscle cell and extracellular matrix. And the extracellular matrix that include elastin and collagen and other fibers. And also the tunica media have the external elastic lamina. And the last and outermost layer is the tunica adventitia, which contain connective tissue and blood vessels called the vasa vasorum. So all of these layers contain living cells, and it needs blood supply to stay alive. So the tunica intima and the inner one half of the tunica media will get its blood supply from the lumen through diffusion of the nutrients, and the outer one half of the tunica media and the tunica adventitia will get their nutrients from the vasa vasorum. So the normal aortic diameter is usually 2 cm, and anything more than 3 cm is considered an abnormal aortic dilatation, which is called aortic aneurysm. So aortic aneurysm have two main types, a true aneurysm and a false aneurysm. First, let's start talking about the normal blood vessels. So as you know, see here, there is no dilatation. In the next picture, we have a dilatation in one side, and this dilatation is lined by the three layers, the tunica intima, media, and adventitia. In this case, we call it a true aneurysm. And since this dilatation is only in one portion of the circumference of the blood vessel, we call it a saccular or a perianeurysm. In the next picture, we have a dilatation involved that is lined by three layers, so also a true aneurysm. However, the dilatation is found throughout the circumference of the vessels, so we call it a fusiform aneurysm. As you see here, we have a tear in the tunica intima and media, causing the blood to go through them and accumulate there, and causes aortic dilatation. And this aortic dilatation is lined by one layer, and maybe in other cases by two layers. However, not lined by three layers. So in this case, we call it a false aneurysm or a pseudoaneurysm. If this accumulates, the blood start to separate the layers, as you see here, and dissect upward or downward. In this case, we call it dissection. So aortic aneurysm usually caused by a weak aortic wall. In order to prevent having a weak aortic wall, or in order to have a strong aortic wall, we should have three factors. The first one is to have a strong supporting tissue, so we need to have a normal elastin and collagen, and we need to have a good blood supply to the inner layer and outer layer of the aortic wall. So diseases that affect the supporting tissue include congenital disease like Marfan syndrome, in which they have defective fibrillin 1, which is an essential component of elastin. Other disease like Ehlers-Danlos syndrome, type 4, which causes defective type 3 procollagen, which is the precursor of collagen type 3. And other congenital diseases like congenital bicuspid aortic valve and familial thoracic aortic aneurysm syndrome. Acquired diseases that affect the supporting tissue include hypertension, trauma, infections, and vasculitis. And the other important factor that can be affected is the inner layer blood supply that can be affected by atherosclerosis. So the atherosclerosis will build here and it will prevent the diffusion of the nutrients to the inner layer, thus causing the damage to the inner layer. And the last factor that can be affected is damage to the vasa vasorum from syphilis or vasculitis. So the most common cause of aortic aneurysm is atherosclerosis, which is basically the degeneration and destruction of elastin and collagen due to the lack of blood supply to the inner layer. And atherosclerosis usually happen in the abdominal and descending thoracic aorta. And the risk factor include age more than 60-year-old, smoking, male gender, family history, and hypercholesterolemia. Another cause of aortic aneurysm is cystic medial necrosis, which is basically means the necrosis or degeneration of collagen and elastic fiber in the tunica media layer, and that is replaced by cystic mucoid material. And usually it happens in the proximal aorta, like the ascending aorta and sinuses of Valsalva, and it will cause a fusiform shaped aneurysm. An example of it include the congenital diseases that we talked about before, and hypertension. Other causes of aortic aneurysm include infections like syphilis that will affect the ascending aorta and aortic arch, the TB or tuberculosis that will affect the thoracic aorta, and mycotic or infectious cause that usually have cause infection at the atherosclerotic plaque, causing a saccular shaped aneurysm. Also, trauma at the ligamentum trauma can cause aneurysm at the ligamentum arteriosus, and we have other causes. So if the aneurysm happen in the thoracic area, it's called a thoracic aortic aneurysm. If it happen in the abdominal area, it's called an abdominal aortic aneurysm. And if it happen both in the thoracic and abdominal area, it's called a thoraco-abdominal aortic aneurysm. And the most common site for abdominal aortic aneurysm is infrarenal, because this site is the weakest point of the aorta because it does not have any vasa vasorum. So this site depends only on the fusion of the nutrients from the lumen, which will be lost from atherosclerosis. So aneurysms are mostly asymptomatic. Thoracic aortic aneurysm can cause feeling of pressure in the chest, thoracic chest pain, thoracic back pain, signs and symptoms of aortic insufficiency or hoarseness due to the compression of recurrent laryngeal nerve. Abdominal aortic aneurysm can cause abdominal pain, pulsatile abdominal mass, and prowy on auscultation. So, if the patient comes to you with a painful pulsatile abdominal mass and hypotension, that means the patient has a ruptured abdominal aortic aneurysm, and you need to take him immediately to the OR to do an emergent surgery. Now, talking about the aortic dissection, which is caused by a tear in the tunica intima, causing the blood to go to the tunica media and start to dissect there and separate the tunica media from the tunica intima. And the normal lumen is called the true lumen, and the new lumen that is made or created by the blood is called the false lumen, and the wall in between is called the intimal flap. So the true lumen usually is round or oval in shape, and it's ready to form thrombus here because it has a really high or high velocity blood flow. On the other hand, the false lumen is concentric in shape, and it is very common to form thrombus here because there will be no blood flow or very slow blood flow. The most common site for aortic dissection is the ascending aorta because it's exposed to the highest pressure, and then the second most common site is just distal to the ligamentum arteriosum and the descending thoracic aorta, especially in decelerating trauma because the ligament, this ligament will pull the aorta during trauma, thus tearing the aorta, thus causing the dissection. Another common site is the aortic arch. So if the dissection propagates upward, it can block the blood supply to the coronary artery, causing myocardial infarction, or it can rupture and bleed into the pericardial, causing pericardial tamponade, or rupture into the mediastinum. If the dissection propagates downward, it can rupture into the peritoneum, or it can compress the blood supply going to the kidney or limbs. So, aortic dissection usually caused by chronic hypertension, trauma, connective tissue disease, or aneurysm. And the patient usually will come with a sudden onset tearing pain that is radiating to the site of dissection. To the site of the dissection propagation, according if the dissection was going upward or downward, the radiation will be. And the patient also will have asymmetrical pulse or blood pressure measurements between the limbs. Finally, I will talk about the classification of dissection. It's important to classify dissection in order to choose what is the appropriate type of management the patient will need. So we have two classifications. We have the Stanford classification and the DeBakey classification, which is rarely used. The Stanford classification classifies dissection into two types, type A and type B. Type A is the dissection that involves the ascending aorta always, with the involvement of the other part of the aorta or without it. The most important is to have the involvement of the ascending aorta, then we call it type A dissection. And in this case, the patient will need surgical management, and it is a surgical emergency. Stanford type B is the dissection of the aorta at any site, but not involving the ascending aorta. And type B dissection is can be treated by medical management. The other classification is the DeBakey classification. As we said, it's rarely used, and it classifies dissection into three types. The first type is dissection that involves the ascending aorta to the descending aorta. Then we have DeBakey type 2, which involve the ascending aorta and or the transverse aorta only, without the involvement of the descending aorta. Lastly, DeBakey type 3 is will involve the descending aorta only. This is the end of the presentation. These are my references, and thank you.